So the first presenter is Dr. Pooja Kamar. And
none of the authors have any financial disclosures. So we have been working on lysyl oxidase and its role in keratoconus since 2010. And over the years, we do have proven that in keratoconic eyes compared to that of controls, the lysyl oxidase levels is on the lower side. And with increasing
can we have no talk in the hall, please? Sorry.
The lysyl oxidase levels reduced. Not only that, but if the lysyl oxidase levels are on the lower side, there is higher risk of progression post cross-linking. And also patients with a seemingly healthy topography and biomechanics, if they undergo refractive surgery, but the pre-existing lysyl oxidase levels are on the lower side, they are at higher risk of developing ectasia, which has been published. Also, there are reports that even after doing a transplant surgery, there are chances of graft failure leading to progression of the disease, suggesting a genetic role in all of this, including lysyl oxidase. So our aim of the study was to explore if enhancing lysyl oxidase expression in corneal cells and tissues is safe and provides potential functional benefits relevant to keratoconus therapy. So ideal gene therapy is safe and non-immunogenic introduction of genetic material by an able vector, and which can overpower the functions of the defective or non-functional genes for therapeutic purpose. And the best way to do is AAV vectors. So we at our hospital have developed this vector production facility where we can produce the AAV vectors, and based on these AAV vectors, you can inject them for a genetic therapy purpose. Now, why AAV vectors? Because they are efficient delivery of genes to both dividing and non-dividing target cells. It has high levels of genetic expression, and it has absence of viral genes which is a potential of causing an undesirable immune response. And also, it doesn't cause any excessive toxicity or excessive immune response when delivered with an AAV vector. So our study was a three-step study. The first was done in ex vivo cornea model, where one eye was treated with a GFP, which is a control agent with AAV, and the other eye was treated with lysyl oxidase, and 5 microliters of this saline vector was injected. So what we observed in the ex vivo cornea model study, that on injecting lysyl oxidase vectors, the lysyl oxidase levels increased. Not only that, it started increasing the levels of collagen 1 and 4, and it also reduced the inflammation. So there was a positive impact of lysyl oxidase, that it increased the collagen levels, which could be a reason how it will stabilize the disease. The second was to do on human corneal donor lenticules. So whenever we do a smile surgery, we would probably discard the lenticule, but here the lenticules were taken, and again one eye lenticule was treated with a control, which is the GFP, and the other eye lenticule was treated with a lysyl oxidase vectors, and the similar results were replicated were found to be in the donor corneal lenticule as well, that the lysyl oxidase and the collagen levels are increasing and the inflammation is coming down. So the third step was to see the different channels in cadaveric eyes, because at the end we have to do the gene therapy in human. So we used the intracorneal ring segment channel, and in one eye again a control was injected and the other eye lysyl oxidase was injected. And after 30 days we wanted to study the strength of the eye. So along with immunofluorescence, the AFM, which is to study the strength of the eye, was also performed. So what we observed here was that this is the control and this is the lysyl oxidase. If you can see, these are the collagen bundles, and you can see good spacing between these collagen bundles in a control eye. However, if you take a lysyl oxidase injected eye, you can see the spacing, which is the collagen bundle spacing, is reducing, thus telling us that the lysyl oxidase therapy not only increases the expression of lysyl oxidase, but also increases the expression of collagen, and it also makes it compact. And on AFM study, which is to see the stromal channels, what is the strength of the eye, what we saw was that on injection of lysyl oxidase, there was an increase in the elastic modulus compared to that of control, and this was a contralateral eye study as well. So corneal gene therapy can be effective. It's why cornea? Because it allows a versatile methods like topical, mechanical, surgical, electrical, and chemical way of injecting it. And not only we can inject it, but we also have imaging modalities like structural and biomechanical changes, which can be studied in the cornea, which is quite effective. So AAV transduction of corneal tissue was safe, and a recombinant AAV-mediated lysyl oxidase therapy can be effective in cornea, can be safe, and can be delivered. So lysyl oxidase augmentation does enhance the expression of collagens while reducing the MMP9, which is also a good thing because it reduces the inflammation. So it can be a potential therapy for keratoconus in future. Thank you.
We can have the judges ask questions for about 1 to 2 minutes and no audience questions.
A single dose is enough, and is the effect going to be sustained?
So ma'am, at this point of time, we do think that single dose will be enough. So this has been done on ex vivo cornea models. We have received approvals from the CDCSO and DCGI recently. So I think maybe in April or May we will be doing it on patients. So at this point of time, single dose should be enough. But the beauty of the treatment is even if you want to repeat it, you can repeat it because you're doing it through the intracorneal ring segment channel and you're not inserting any rings. So you can again open up the channel and inject the vectors if needed.
How are you going to follow patients? You see your first human trial is going to be in April about. Congratulations.
Thank you.
And how are you going to follow the patients?
So the follow-up of the patients is going to be day 1 week, 3 weeks.
Sorry, and how are you going to determine?
So we aim to do corneal topography scans, the biomechanical changes through the Corvus ST model because it will tell us that because the lysyl oxidase and collagen is increasing, whether the strength is increasing. Because on AFM model, we have seen the strength is increasing, but we need to see, so which will be done with biomechanics. We do have a tool, a diagnostic tool in our hospital, which is a polarization sensitive OCT, which will help us see the collagen orientation and density in the thing. So we will be doing that. And for to see whether the levels of lysyl oxidase have increased, we'll have to do a tear diagnostic test. So all of this will be done as a part of the trial. Thank you.